Hi, I'm Dr. Sam Mann, and this is Beyond Conventional Medical Thinking. Our topic for today is ADHD, and the purpose is to describe a treatment that is not used that may be very helpful for some patients. So, ADHD, it's not rare. About 9 million adults have it in this country. It has different manifestations in different people. It has elements of hyperactivity, of attention deficit. Treatment generally is amphetamines such as Adderall or methylphenidate such as Ritalin, Concerta. And if somebody cannot tolerate those medications, another alternative are the blood pressure medication clonidine or guanfacine, which inhibit the sympathetic nervous system but have a side effect of fatigue in many people. In fact, clonidine I rarely prescribe to patients who see me for their hypertension. I am a hypertensionist because of those side effects. So, where are we going today? Well, how's the state of treatment of ADHD at this time? And the medications that I've mentioned are generally used in adults with ADHD. The response rate is cited in studies to be about 70%, although only 10 to 30% have complete relief from their symptoms. Often the problem is that these medicines are stimulants and people feel more on edge, tense, can't relax on them. They can also raise blood pressure in some, and benefit may wane after people have been on it for a long time. Now, you may ask, why am I talking about this? I'm not a psychiatrist, I'm a hypertensionist. And this is a good example of how in medical practice you learn from experience, and you often learn things when you least expect it. And you see it again and again, and it makes sense. And this is a beautiful example of learning from experience. And my experience was in seeing patients who came to me for their blood pressure who happened to also have ADHD. And so, for example, a patient I saw several years ago prescribed a beta blocker, which I thought would be good for his blood pressure. And he came back and his blood pressure was better, but he said his tension that he could never get rid of was much better. And in fact, he was able to reduce his stimulant and he was feeling better than he had in a long time. And it persisted. And months or a year later, I saw another patient who also had hypertension and ADHD. So, all right, let me give him a beta blocker also. And he came back. And whereas the first patient told me he was able to reduce his medicine, this patient said he got off his medicine and he's just on the beta blocker and his ADHD is fine. And so I noticed over the years, not a large number of patients, but let's say about 8 patients, about 6 of them felt better. And the main symptom was tenseness that they could not get rid of. And some of them were able to reduce their medicine, not all, but 6 of the 8 felt better. So, where do we go from there? Well, what do the studies tell us? So, I looked up studies of beta blockers and ADHD. I could not find a single study that has looked at the effect of beta blockers on ADHD. Not one study. I talked to psychiatrists. They were not familiar with a beta blocker being used for this. How come a study has never been done? Well, you have all these expensive medications, and beta blockers have been around for decades, and they have a huge market for hypertension and heart conditions. They don't need to do an expensive research program for use in a smaller population to use their generic drugs, which are inexpensive. So pharmaceutical industry would not be interested in doing this. Again, the thought was what they were telling me is that this is revolutionary thinking. Nobody is giving a beta blocker for ADHD. So how is it working then? If this is not an ADHD drug, how's it helping? Well, first of all, patients have increased tension on these stimulants that are used to treat. And this can help reduce some of that tension. So it can be helping by blocking a side effect of the medication. Another possibility, some patients who have ADHD also have an anxiety disorder, and maybe it's treating the anxiety disorder that they have in addition to the ADHD. And 25 to 50% of patients with ADHD do have also an anxiety disorder. And then finally, maybe the diagnosis of ADHD is wrong. Maybe they don't have the ADHD and they just have a very tense anxiety problem, and it's not ADHD and it's treating an anxiety disorder. So all those are possible. But the bottom line is it looks like it helps. Now, with these compelling observations, I really would like to get the word out about this. I think it needs to be considered and possibly tried, but there's no awareness of it. And how do we get the word out? And I emphasize also the beta blocker is a safe drug. And it also has the advantage it works quickly, so that if somebody tries it, they're going to know within 2, 3 days at most, either it's helping or it's not helping. You don't have to be on it for weeks or months to find out. So it's quick, it's safe, it's used widely for heart conditions and for hypertension. And one question comes up, well, if you don't have high blood pressure, can you take it? And the answer is yes, because people with heart arrhythmias or other conditions, all of them take beta blockers. Even though they don't have high blood pressure, they can take it. So that's not a problem either. So one concern, an adverse risk of the beta blockers is it can aggravate asthma. If you have significant asthma, I would not recommend it. If you have mild asthma, check with your physician. The other question that comes up is what if you have a slow heart rate? Because beta blockers slow down the heart rate. If you have a heart rate in the 50s or lower, then you should consult with a physician. You might be able to try it, but I'd be cautious about that if you have a slow heart rate. Question is next, which beta blocker? The best-selling beta blocker is metoprolol, but two aspects of metoprolol bother me, and I tend not to prescribe it. One is it is metabolized by the liver, and different patients get a different blood level. So for the same dose, patient A can have a blood level of 20, and patient B can have a level of 200. That's how variable the blood level is, which is tricky. The other problem with the metoprolol is that it's not a selective beta blocker. It blocks beta 1 receptors as well as beta 2 receptors. Don't get hung up on that. The metoprolol is a beta 1 receptor. The beta 2 receptors, blocking them could aggravate the asthma. So a clean beta 1 beta blocker is probably a better idea. Those are the main reasons why I prescribe the bisoprolol rather than the bestsellers. Finally, I think this is an important matter because the use of beta blockers does not exist in the minds of psychiatrists. It's not used. I cannot publish a study because I cannot do a large enough study to do it. But what I'd like to suggest is if you try this, and you can contact me on my website, drsamuelmann.com, double N, and let me know a few things. I'd appreciate the feedback, and I want to know how many people it helps or doesn't help. So if you respond to my website, drsamuelmann.com, and click on podcasts, it'll give you a box to put in the information. Please put in what medication you were taking for your ADHD. What was your main symptom? Was it tenseness, anxiety, inattention? Which beta blocker you used, hopefully the bisoprolol. And importantly, did it help or did it not help? Or did you have adverse effects from it? And as much as I'd like to see those who are helped respond, equally important, maybe more important, those who it did not help, please be sure to let me know, give me the feedback. And I'm hoping if I can get enough replies and create a report that has a bigger number and see roughly what percentage are helped by it, maybe we can get somebody to do the research for it, because otherwise, this treatment approach is not going to get attention for years, and it could be very important to many people. Also, when you respond, put in, did you reduce your medication as a result of taking the beta blocker? Did you reduce your stimulants? It would be very important for me to know both how you're feeling on it and also whether you were able to reduce medications that you were on. Finally, to sum up, the idea of beta blockers for ADHD, there is no published data. I'm compelled to do this podcast because I've seen a majority of patients with ADHD to whom I gave a beta blocker improved with it, and particularly felt less of that tension that they could not get rid of. If you have ADHD and you're not feeling that well, consider a trial. Only 2 days. It's bisoprolol. As I said, it's a 5 milligram pill. Start with a half a pill once a day for 2 days. If that doesn't help, try a whole pill for 2 days. And that's as far as you need to go to find out if it's going to help or not. So the intervention is simple to try. It's inexpensive. If it's going to help, it'll help quickly. Please discuss with your psychiatrist, and obviously you'd want him in the loop. It's his area of specialty, not mine. If your psychiatrist would like to contact me, he can contact me through that same website, drsamuelmann.com, and click on podcast and send me his contact information. And that's about it. If you do have an issue of a slow heart rate or asthma, then do check with your physician before trying it. Otherwise, give it a try. Let's see if it can help. And if we find that it does help a majority of people, which is what I've found in my small series of patients, I think it would be so wonderful to get the word out on this alternative treatment that is simple, it is inexpensive, and it may help many, many people. A reminder, if you have any questions through my website, click on podcast and put in your question. I'll try at some future podcast to put it in at the end where there's leftover time. Please get the word out. Get it out on social media because there are people all over with ADHD, and the more people hear about this, the more we can give it that trial and see if this represents a new means of treatment that can be helpful to many people. Also, generally, I'll have a new podcast the first and third Wednesdays of the month. Thank you for your attention, and please help get the word out. Thank you.